Hello, my name is Dr James Waldron. I'm a portfolio GP in Nottingham, a GP educator, and I also co-host the GPnotebook study groups. And welcome to the GPnotebook podcast. Here you will find a whole range of bite-sized topics aimed at all of those working in primary care. Perfect way to update and entertain you on the morning commute, or in fact, anywhere. You can find us on all major podcast platforms. Follow us to receive notifications about new episodes, and if you like what you hear, please leave a review to help other listeners find us. You can also follow us on X at GPnotebook for info and updates on podcasts, study groups, and more. You can also follow me at Jammiest Dodges. Finally, check out the show notes and have a look around on our brand new GPnotebook website. There is info on signing up for study groups, lots more education, and loads more resources. In this episode, we will join Dr Alex Lai of the WorkWell Doctors to discuss digital wellbeing for clinicians. We hope you enjoy it. Alex is one of the founders of the WorkWell Doctors. He is a fellow early career GP. He has been LMC chair in his local area and a technology enthusiast and a real passion for mental health and digital well-being. And so I'm really glad that he's been able to join us today. Welcome, Alex.
Thank you very much for having me, James.
So let's start with hearing a little bit more about you. What brought you into this area of interest?
So I guess I've always been involved in sort of pastoral care and advocating for healthcare professionals ever since the first junior doctors' strikes in 2015 and the large exodus of doctors, demoralization, burnout, became more interested in ways of preventing burnout and exploring how to support healthcare professionals. And then, of course, during the pandemic, a spotlight was shone on the importance of prioritizing staff well-being. And unfortunately, I myself had some challenges during my GP training where, unfortunately, my partner became very unwell and I had to go less than full time to become a mental health carer. So together, these caused me to recognize the challenges that we were facing in healthcare and primary care. And so together with another GP colleague, I set up the WorkWell Doctors, which is an organization that supports the mental health and well-being of healthcare professionals. And we've spent the last 4 years really looking at the research and the expertise and the knowledge that is out there around how we can support healthcare staff to live well.
Brilliant. That's a wonderful mission. And it's really nice to hear the stories that come through of the things that really inspire people to develop that specialist interest, to find things that really are important to them. So thank you for sharing that with us. In fact, I was very privileged to be on the receiving end of one of the WorkWell Doctors talks at a conference a little while ago, which sort of stimulated us to have this discussion and to bring you onto the podcast. It was all about digital well-being, and I thought that was a really fascinating topic and something that is just becoming more and more prevalent. What do we mean by digital well-being, do you think?
Good question, James. Normally in our workshops, we ask people, what do they think digital well-being means? So Google defines it as about crafting and maintaining a healthy relationship with technology. So it's about how technology serves us and moves us towards our goals rather than distracting us or interrupting us or getting in the way. So digital well-being is about recognizing that technology has infiltrated our lives substantially, but how we can be in control of it and make sure it's not in control of us.
Yeah, I mean, that is the ever the challenge, isn't it? And I sometimes think, as I look at my phone, and of course we're doing this on Zoom, which is yet more technology, how we would cope in modern society without it. But as I said, it infiltrated it. It affects every aspect of things that we do. We talked about how much screen time. You talked about how much screen time that we use. What's the sort of data? What are we looking at in terms of time we spend either looking at our phone or looking at another screen?
What I would suggest is that everyone listening to this podcast right now actually looks for themselves at their data. So it's very easy on a Google phone or an iPhone to go into your settings and look at your screen time. And it is sometimes bewildering how much time we spend on our phones. And it's also useful to look at which apps in particular are a culprit, because there is a concept called time confetti, where you have a set period of time where you think that you will be able to achieve all of your admin and tasks, and it just disappears. And often our phones can be a big culprit for taking away that time from us.
Yeah, I mean, in preparation for this, I looked up my own screen time, and I recognised, I think I wouldn't have thought I was a particularly high user. It says here 2 hours 48 minutes, which is quite, 22 minutes of that was maps, so still 2 hours 20 minutes on a phone, and I wouldn't consider myself a particularly high user. So it is taking away time from everything else, isn't it?
We have seen a lot worse during our workshops, and that's okay. It's just useful to have that insight, to set that reminder, have that check, and then be able to respond to it.
Well, in fact, one of the things that you set as a challenge to do at that particular workshop was to put some timers on the apps that we use the most. And for me, BBC News was a particularly big one for whatever reason. I kind of get sucked into speaking to that. So I've set a half an hour timer for that, and it does bleep and say, hey, you know that you've been here for half an hour. Would you like to extend that by 5 minutes? And now that's it. Yeah, so that's good. I think this whole concept of sort of being constantly connected is quite interesting around this. What would you say? Would you say that's a problem, being constantly connected to each other and our phones? One might argue that is very valuable. I could contact you anytime I want. We arrange this meeting via WhatsApp. Is that a bad thing?
Nothing is ever good or bad. There are always pros and cons. There's an interesting sort of proverb around the number of people that make a village and how many people we were meant to be connected to. And we have all seen the damage that social media and the spreading of misinformation has caused. At the same time, there are media doctors who've managed to raise awareness to various topics and reached a far wider audience than they would have otherwise. But I don't think that we were meant to be connected in this format, in this manner, and
at this quantity.
there is a difference between digital connection and human physical connection, as we all experienced during the pandemic. And people differ in what they require, but we know that it has benefits and we know that it has disadvantages.
Yeah, I think I'd have to agree with that statement. Thinking about the digital connections that we can have, and especially during lockdown when the digital communication was the only thing that we had, and looking at the benefits it's brought, and the fact that you can be in London, I can be in Nottingham, we can have this conversation, this recording, and we can do education and CPD across areas, but it's sometimes at that expense of the physical interaction and meeting people face to face, which I think is very important and perhaps hasn't risen back to the top of people's priority list because of the ease of just logging on your phone.
And there's two things relevant to GP work here, especially. One is death by Zoom. The number of meetings now that are done virtually, and that lack of networking that we used to get. So, for example, my entire LMC chair tenure was virtual. And so at the end, as we were opening up again, actually getting to meet people face to face, it felt so unusual. But prior to that, when I was a rep, we did get to meet for lunch and have those chats and those informal conversations that you just couldn't get through Zoom etiquette. And then the second thing is around the constant availability we now have as clinicians and colleagues, and how do we set those boundaries so that, bringing it back to digital well-being, we make sure that the technology doesn't consume our lives, and it's only us taking advantage of the technology.
Yeah, I think you're right. I remember back to that workshop, and I think you asked people show of hands to say who's sent an email back to part of their jobs after 9 o'clock at night routinely, who checks their emails as the last thing they do before they go to bed. And it's very difficult to switch off properly and have that kind of professional space. So how do we ensure that boundaries are set, and where do we draw the line? How would you say that we maintain safety and retain our personal space around digital working?
In terms of those boundaries that we were talking about, I think it's really important that we set those boundaries. We know that with the introduction of new technology, we've seen the vast, exponential rise of AI and how legal systems haven't been able to keep up. I think it's really important in GP practices to discuss. We've said the same in hospitals when we've gone into trusts and talked to the staff, like, what is the protocol for messaging? Because we know that the concern is the fear that you're going to miss something. But actually, WhatsApp is not the appropriate channel for communicating with someone. Oh, do you know what happened with patient X? And so actually, if I'm on the weekend with friends, family, kids, actually, that's not the best way to reach me. And so everyone does know that in an emergency, you would be called. So actually, do not expect me to respond to WhatsApps on the weekend or on my annual leave. Therefore, can we set some boundaries as a team and as a surgery and say, we won't expect you to respond after whatever time in the evening. We won't expect a response on the weekend. And the same goes for email. My email signature says I work on these days. I may send emails outside of work hours. I do not expect a response. Because the worst thing you can have is those emails where they send it on Friday afternoon at, 5:55, and then they message on Monday morning at 9:05 and say, why haven't you responded? And it's like, well, you've given me 10 minutes of work time to actually respond. You shouldn't expect me to call or respond to that.
Yeah. Drawing those lines in the sand and setting boundaries is so important. And we talk about this to our patients quite a lot as well, but it's really difficult, especially when everybody's connected so well. And we were talking before a bit about when colleagues might say, well, I don't want to use this aspect of technology, but everybody else is. It can be quite hard to combat that. And, well, such and such is replying in the evening, or they've sent an email on a Sunday, and it feels like there's a bit of an internal imperative to do it. And it's a hard thing to combat because it has infiltrated little by little into our lives, isn't it?
Absolutely, because I've even spoken to people in Silicon Valley who look at apps and what do they do with their children, and do they let them use the iPad, because you don't want to have them left behind not being able to interact, and maybe there's a slight negative connotation about the word boundaries. There shouldn't be, but it's a discussion. It's a discussion and an agreement amongst your work colleagues. It's slightly easier amongst GP colleagues, perhaps, than a whole hospital trust, to be able to say, actually, this is what we expect and what we don't expect, and have an agreement, because then you're able to say, right, this is our protocol. We've had a discussion around digital wellbeing. We wouldn't want you to be answering your phone at this time. You won't be left out. We will make sure if there is anything urgent to give you a call. And the same goes in the same way that we wouldn't want, a patient complaint to be a notification via email from the practice manager. It's much nicer to have a chat about it in person. And so we just need to be mindful of how we use technology.
Yeah, remembering a bit of humanity, and that, that throughout our evolution, we have been in person in-person animals. So that's really interesting. But
we know that body language, as with our patients, is so key. When we're doing telephone consultations, it's much harder. We have to be mindful of our language and those verbal cues. The same goes for much can be misconstrued via email and texting.
Yeah. Yeah, I think that it's really, really nice segue onto the next part of what we're going to talk about, which was about sort of technological changes and the benefits and challenges in primary care. So we've mentioned a bit about online meetings and some of the issues around that and some of the benefits. How about sort of within our practice? How do you see that changing?
So funnily enough, I've now taken on a digital health fellowship because whilst it's been lovely to work on the ground supporting healthcare staff, it's clear that, workload and admin is one of the biggest contributors to burnout in the workplace, especially GPs. And so I wanted to go upstream and tackle some of these issues. And I'm now working at a fantastic practice where they do use online triage. And so I'm seeing some of the challenges around the increased demand because we've made ourselves so accessible, but also the advantages of being able to use AccuRx to send my patients, patient information leaflets and use it for, photos of dermatological conditions and being able to notify and send more information and email them and let them self-book into appointments. And so there is something about making sure that, again, we do everything we do because of our patients. But we all want to have the continuity of care, but we also recognize the challenges of the government agenda around access and not being sort of committed to some of the losses that we might experience from that.
Yeah, an ever-challenging thing, sort of embracing the technology. And as we started this talk off, talking about the making it work for us, not working for the technology, and making sure it's improving things overall rather than detracting. And one of the things I sort of was thinking about, as we move to more a sort of office-based, sitting behind a computer for either portfolio work or in general practice, and we're doing more stuff, that it does have a kind of a physical impact as well, doesn't it? That more time staring at a screen, more times sat down, and I think that's probably, we shouldn't underestimate the toll that might take as well. So this sort of technology changes do have knock-on effects.
Absolutely. I don't know about you, but when I envisioned becoming a doctor when I was younger, I never envisioned that it would be sat at a desk for 10 hours of the day, staring at one or two screens plus my phone. And you're sat in a posture that isn't necessarily healthy in the same way that we would like to portray and role model for our patients. I'm fortunate I do have a standing desk and I do my admin with music and I stand up and I do these exercises where you stand on your tiptoes to contract your calves, sort of these simple measures, because we know that actually it's such a sedentary lifestyle that we didn't expect. And we wear out our eyes, looking at something so near and always having this brightness. Many people suffer with migraines. And so it is important to be mindful of our own health and physical health and mental health when interacting with so much screen time at work as well as at home. And how can we find that balance? What can we do to support our colleagues with that? Most people think that standing desks are really expensive. It doesn't have to be the electric kind. You can get a cheap converter, which uses a hydraulic button to lift the computer screen up, so that you can do your admin standing. Actually, it's great for role modeling to patients. They tend to appreciate face-to-face that they're asking, maybe in the old days we used to ask about a different dynamic. Maybe you can encourage them to stand with you if they're not an elderly or disabled person.
It's fun. It's funny you mentioned this. I actually installed the standing desk converter in my consulting room on Monday, and I wasn't entirely sure. I came in, they saw it, they're like, "Oh," and I said, "I'm just trying this. Would you like to stand?" It's like, I prefer to sit, so down it goes. We sit down, and then up it comes at the end, and I'm just not entirely sure how to do it. I'm at the university practice locally, and they've all got standing desks, and they're all standing up. But I wonder whether that's maybe a bit of a demographic and what patients think about it.
Yeah, and it depends on your cohort of patients, and what they deem the norm or the conformity of general practice, and their own perception of what a GP looks like. But certainly I would say, when you are doing your admin, that's your time to get up, and then making sure that you're following a 20-20 rule of looking away for 20 seconds every 20 minutes. We know that radiologists follow that because they're staring at a screen for a long time and they know it affects their concentration. Get up and move. We also have seen some, at the moment, elementary studies around genes in our muscles and the ones involved in lipolysis and breaking down fat and turning off if you are sedentary for more than 20 minutes. So it's interesting to think that actually we're contributing to our own negative health because we're spending so long sitting. And the importance of getting up and going to get the patient rather than using the buzzer.
Yes. It's interesting when talking about this. We say get up to go and get the patient rather than using the buzzer. Absolutely understand the steps in there, but I think a lot of this is done. A lot of the advancements we make are to do with in the name of efficiency and productivity. But actually, we were talking a little bit before about how useful a phone is in practice, but it's a distraction. It's there in the room. You were mentioning an interesting study about just how amazingly distracting phones are. Do you want to share that with us?
Yes. They did a study with university students where they got them to do a test, and they had their phone on the table, and then another set had their phone in their pocket, and then they had another set where the phone was in another room. And it wasn't until the phone was in another room that their scores improved. So their actual cognitive function and high scoring went up when the phone was in another room, because they used a metaphor of how the phone is like a packet of cigarettes for a smoker. It is there, and it is calling to you, and it is addictive, even if it is in your pocket. So not until it is out of sight and in another place did their scores improve and their sort of brain function.
Even with it off, I understand as well. It's like, it's there, it could be going off. And it's a kind of constant vying for our attention. When I was looking at my digital well-being again, I get 250 notifications a day. That's a lot of bings.
Not only bings, but those bings, neurochemically are saying, I want your attention. I want your attention. What could this be? What if it's really important? What if I need you to respond immediately? And we're all privy, we're all liable to it. And so again, it is having to lock our phone in a drawer, or
that's what I do at work.
Setting our own boundaries and alarms for ourselves, which is really difficult because it is so integrated into our lives, and it is a social norm that what if your child is sick and the school tries to call you, and what is your backup? Do they know the workplace and are able to get through to the receptionist to get you? So it is a challenge, but it's a very slow creep. And so actually what's beneficial is sometimes setting these intentions and setting a reminder every month to just check in with yourself, because I know it's challenging. I'm not perfect in any way or by any means, but it's just an awareness.
Yeah, no, absolutely. I think being aware that we as highly trained doctors and GPs, we're still susceptible to it, because I think there's a tendency to think that it's a teenager problem, that it's a young person problem only. Although we're still young, we're in our early/mid 30s. We're still young, but the tendency to think that it's just the teenagers. But I think that we're particularly vulnerable as well, just because where we work and the stresses that we have going on around us. So we've talked a lot about this. We've talked about it. It's almost like a pack of cigarettes in the pocket. We've talked about the impact of sitting for too long and staring at screens. So what can we do about this? What would you suggest that we could try and do? We talked about 20 seconds on, 20 seconds off with the screens. What can we do? What's our fear here? What would we be worried about?
I guess there's many different ways, and we're all different. Ironically, sometimes we need other technology to support us in not using technology. There are sort of nanny apps, as you said, to set timers on BBC News, your social media, muting WhatsApps so that you're not constantly getting the notifications. Is that absolutely necessary to check in with? The same with emails. Actually, we know that we often check things on our phones whilst we're on the move, and then we read it, and then we mark it back as unread to deal with later. So you're doubling up your task workload, because it's far better to set a time to respond to emails first thing in the morning, and at the end, middle of the day and end of day. And outside of that, it's very rare that it's going to be an urgent email that you're going to have to respond to within the next 5 minutes. The same goes for EMIS or System 1 and your screen messaging and your tasks. You don't want to double up your workload and half read something and then have to come back and check all of that information again. In terms of our boundaries and our digital boundaries, I think it is crucial to have that discussion with your workplace and with your family or whoever you may live with. Too often, phones creep onto the dining table, and it's really important that we have that social interaction without interruption. Thinking about when you're going outside for a walk, do you take your phone? Yes, it's again advantageous to listen to a podcast on your commute, and it feels useful and you're learning new information. But also sometimes if you are just going for a walk, you perhaps want to not take your phone. You're going for a 10-minute walk at lunch around the block, get some vitamin D. Actually, we don't necessarily want to always input more information, because we need that reflection time to be able to process the information that we've already input. And that's not always possible when we're constantly adding more from digital technology, whether it's social media or music.
I think when we talk about mindfulness, which is is a thing that I think most GPs will be at least partially familiar with, it's very difficult to do that when there are other distractions. And one of the things I muse, we're talking about like going for a walk without, I find myself filling dead time with podcasts or YouTube videos, which is all about learning, and that's great as well. Particularly say when doing the washing up, but it's got to the point where I can't do the washing up without a podcast or a video or something like this, which doesn't necessarily seem like the absolute healthiest way of doing it. And it's so difficult. I mean, I again, following the last time we did it, I decided to have a mindful morning where I'd get my hair cut, go for breakfast on my own, and just people watch. And I decided to put my phone off and in my pocket. And I recognised that I reached for it 5 times, despite it was off, and despite it being in my pocket, because I've lost this ability to do nothing. And I think this is my real fear or one of my fears with this kind of overarching technological aspects.
And you've said something key there, which is something we definitely advocate for, which is this thing of doing nothing, because we work so hard to get to where we are. And that involves doing so many things that we so often don't appreciate doing nothing, whether that's because we feel guilty, unproductive, shame, whatever it is. Actually block it off. We suggest blocking off the time to do nothing, because, you know, I always remember, okay, kind of cute story, but Dad always goes to the loo in the morning, and that's his time to sit and think. And that's when a lot of his business ideas came. And that's backed up by many entrepreneurs who had their best ideas when they actually had nothing to input into their brains, and they were able to reflect and process and then solve one of their key problems that they were facing. But too often we are bombarded with, you know, notifications and things to watch and things to listen to and people to speak to, that we don't give ourselves the time to just think and reflect. And so if it's useful, if you do find that, you know, using your phone is too prevalent for making notes and you will get distracted and go on the internet, that is why there has probably been an upsurge in gratitude journals and going back to the paper form where we won't get distracted. You know, I love a good train journey and a plane journey for sometimes not having Wi-Fi and actually being able to do some great work and writing and thinking.
That's I think it's a wonderful intention to have when we're talking about this sort of digital well-being, and I think a really nice place to sort of round off today's talk. It's been really, really interesting talking to you, Alex, and I love kind of the journey we've come across from sort of like putting this in the mental health context and looking at how digital solutions can both enhance our lives and our practice, but can also have some of those impacts. And I think that one of the things I'm really going to take away from this is trying to find some time to do nothing, to have that great idea, to, you know, to figure out what I can do to solve some of the problems that come in life and at work.
Absolutely. We're relying on you, James, to solve some of the many issues that we're facing in general practice right now.
Well, I'll do my absolute best, but there are no promises. I've got to learn how to do nothing first, and maybe I'll start with doing the washing up without a YouTube video playing. So maybe that's what I can do for this evening. Well, it's been wonderful, and we've got I'm really happy to say we've got another podcast with yourself lined up. So this one's been a bit more about professionals and about how we sit in this. We're going to have a look about consultations with patients, with young people. We're going to have a bit of a focus on and digital media and social media and the impacts it might have on their health. So I'm really looking forward to that, and hopefully people will tune in for that too. That's really wonderful. One thing before we go, you mentioned WorkWell at the beginning. Is there a way people can get in contact with you about that and bring that to practice? What sort of things can you offer them?
Yes, we often put tips or share information on our Instagram at the WorkWell Doctors, and feel free to contact us at theworkwelldoctors@gmail.com if you'd like to arrange a workshop for your PCN or your practice. We've often done it through training hubs as well.
Oh, brilliant. Yeah, we'll pop a link at the bottom there. Well, thank you again, Alex. It's been absolutely wonderful to talk to you. And I look forward to our next conversation. Thank you. So thank you all for listening, and we really hope you found this podcast helpful and interesting. More info and links for this episode can be found at GPnotebookpodcast.com. And if you've enjoyed this episode, don't forget to follow us and perhaps leave a like and review. We have loads of other podcasts and topics that you can listen to, so have a check back through the archive. There's a lot there to discover. Feel free to get in touch via social media at GPnotebook, or email us if you've got any questions, comments, or ideas for future podcasts. You can also head to our brand new website to register for our virtual GP Notebook study groups and download free resources and shortcuts to help improve the lives of patients in primary care. Thank you for joining us, and we'll see you next time.